Hey guys, it's Dr. Bickling from Own It Dental. As always, here's my contact information if you need to get a hold of me. If you guys are enjoying these videos, please do hit that like button. It's that little thumb right down there. It only takes you a second and all the cool kids are doing it. All right, today we're going to get in today's video and I'm going to talk about how I don't recommend dental treatment, and nor do I allow my doctors to recommend dental treatment. But it's not the way you think it is. So let's dig into it. All right, as many of you might remember, a couple weeks ago in a video, I told you that I banned the word recommend in my office. I don't allow my doctors to recommend dental treatment. And so today's video, we're going to talk a little bit about that. The problem with recommending treatment is, and of course I'm not saying that we don't give patient options and educate them and all that stuff. Of course not. We do all those things. But we just take a kind of a different spin on it. And the problem with recommending treatment is I'm basically telling the patient what I think, what I would do. And so when I do that, I'm talking at the patient. They have the right to disagree with me, right? If I tell them something, they don't have to believe me, and they don't have to listen to me, and they don't have to accept my opinion. They have the right to ignore me, So when I'm talking at somebody, they could disagree with me, they could ignore me. And if I do end up coaxing them into doing something and something goes wrong, then they certainly have the right to blame me. So in any case, recommending dental treatment is basically me telling the patient my opinion and what I would do. And I'm certainly not saying that dentists are bad people by recommending dental treatment. I believe that most dentists are good people and follow the golden rule. I would do unto others as I would have done unto me. The problem with that statement is that it's always coming from my perspective. I would treat people the way I want to be treated. Well, what if the patient doesn't want to be treated the way you want to be treated? What if the patient can't afford the things that you would do? What if the patient doesn't think the same things that you think? Well, then the golden rule doesn't apply, and it's not very empathetic, is it? See, I started to learn the difference here after reading this book by Chris Voss. It's called Never Split the Difference. And he uses this thing called tactical empathy in his job. So Chris Voss is a former FBI hostage negotiator, and he's got to have 100% case acceptance or else he's failed. So he uses tactical empathy when he's doing a hostage negotiation. He's always trying to find out what the other side wants, what the other side is thinking, and what the other side is feeling. And he's trying to put himself in the other person's shoes. He's not telling the terrorist his feelings and his thoughts and his recommendations. He's trying to let that other person know that he understands what they think and what they feel. So I always like our doctors to use empathy when we're discussing treatment with patients. And empathy comes from the Greek word meaning in, and pathy or pathos meaning disease. So you're literally putting yourself in the other person's disease. So I don't know if you think it's the exact opposite of do unto others as you would have done unto you. No, it's do unto others as they would have done unto them. And what you have to do is you have to find out what they want and what does work for them. I always say that, patients who are coming in looking for an opinion, they're not looking for your opinion. They're looking for their opinion. And it's your job as a dentist to help them find it. So as I've banned the word recommendation, excuse me, and I don't allow my doctors to do it, it forces my doctors, instead of recommending treatment, to find out what the patient wants or what works for the patient. And that forces them to ask the patient what they want. Mr. Jones, I see you have a missing tooth. Tell me about that. Question. Are you interested in replacing it? Question. Are you familiar with your options? Question. What are your thoughts on dental implants? Question. Have you heard of a bridge? Question. If you had to choose between one or two, what would work for you? Question. And so through a series of questions and listening, eventually the patient will tell you either what they want to do, what does work for them, or what doesn't work for them. And once they do that, all you have to do is go, okay. I posted a little video about okay dentistry and some other videos about speaking in questions, and I'll post some links up here. But when you ban the word recommend from your lexicon, the only thing you're forced to do is forcing your doctors to talk less and listen more. You're in essence letting them know that you want the patient to tell them what they need. And our results have proven it. I have tripled the national average of production per field hygiene visit. My associates have doubled the national average. So, taking a more tactical empathy approach and banning recommendation and simply going at a treatment plan process a different way will get you the results that you're looking for. So in any case, I hope you enjoyed this video. Think about banning that word. That's my recommendation, and I'll see you on the next one. Talk to you soon. Bye-bye. If you enjoyed this video and want to see more content like it, go to ownitdental.com or click the link above and check out my services. I have dozens of hours of training videos and have negotiated reduced lab fees for all my clients. So if you want to get out of the dental chair and start owning your business, go to ownitdental.com and check out my services, and I'll see you soon.